everybody. Today we're going to talk a little bit about the upcoming workshop on injury prevention, and I'm going to answer the question, do weak muscles cause injuries? That's pretty much a common understanding in the health world, that if you have a injury, it's because the muscle is not functioning properly. It's kind of weak. Therefore, when you go to do an action, we have a pull, strain, pain, discomfort, cramping, any of these kind of things. That is, in a self-care way looking at it, part of the truth. The reality is a little bit more interesting in the fact that it's better to say when a muscle or the quality of a muscle is not correct to its ability, then we have an issue. That being said, muscles can have different characteristics. Each of these characteristics have to kind of be used at the right time for there to be an appropriate function. Sitting down, standing up, throwing a ball, lifting something above your head. When one of these muscles lacks the quality that it's supposed to have, sometimes it is strength, sometimes it's stability, sometimes it's a synergistic style of movement, then we have the body being more susceptible to injury because things aren't functioning as a group, essentially. I guess that's the best way to say it. So in self-care, we focus on muscle quality. And in restoring the muscle quality, then all other things go back to their moving order. That being said, in which scenario would you see this kind of playing out? I think that with limping or a change in the style of walk, this doesn't seem like a big deal. And when it starts up, it's not really a big deal. Maybe there's some tight muscles, maybe there's some muscles being overused. However, the progression of this is where things become a little bit more not so great when it comes to health and preventing injury. This limp will slowly turn into something that causes discomfort. The hip might become irritable, causing pain, lack of sleep, and eventually the wearing down of the bone. Most of the time it is a muscle that's not working properly that then affects the joint, and then we can have the arthritis and these kind of things that we want to stay away from, because that is the main reason essentially people will end up having a hip replacement, knee replacement, these kind of things. So we can stop that from progressing, or at least lessen the progression of that, or get rid of the pain, or make sure that it all goes away. We shall see when we meet and talk a little bit more about how the injury prevention stuff works. Ultimately, another way to deal with this kind of discomfort is exercise, and most people will say that exercising is great to prevent weak muscles. And that, again, is if the muscle's actually weak. If the muscle is kind of functioning in a way that it should not, then exercise can increase the stress on that area. So you can see why muscle quality is a little bit more precise to the issue. That being said, not every exercise is made equal. Ultimately, there can be people that do lots of physical work for work, construction, or anything that you're being very physical in. However, that doesn't particularly mean that they're extremely healthy or fit or can run a couple blocks, because just because you use a muscle doesn't particularly make it strong. But if used under certain guidance, then that will be the case. You will become stronger. But there's a point, again, where that needs to be balanced out with the other muscles, and therefore it stays in kind of a synergy, everything working together. If a muscle is, let's say, overused, then the qualities of the muscle changes and can result to different styles of injury. Generally, when a muscle keeps getting hurt, a reoccurring injury, they call it a chronic injury. Therefore, there's something that is kind of the weakest link in the chain, and that is the thing that's causing the discomfort, and we have to kind of reduce that stress and then build back the function back into the body so that we can have more long-lasting change. Now, that's a quick video on injury prevention from a self-care perspective, and how we want to kind of build on this concept when we will be doing our workshop, which is coming up. Thank you very much for listening, and hopefully that was insightful.